Hi everyone, welcome back to my channel. In today's video, we are going to talk about the diagnosis and treatment of gastric cancer. We'll cover the latest diagnostic methods, current standards of treatment, and cutting-edge therapies, including those under clinical trials. Let's dive right in. Detecting gastric cancer early can significantly improve outcomes. First, we take the medical history and perform a physical exam of a patient. A detailed history focusing on symptoms such as abdominal pain, weight loss, and early satiety is taken. Then we examine for signs like lymph node enlargement, the most common of which is the left supraclavicular node or the presence of abdominal masses. Following this, an endoscopy is done. Usually an esophagogastroduodenoscopy is performed, which is the gold standard. This allows direct visualization of the stomach lining and biopsy of suspicious areas. These tissue samples, which are taken during endoscopy, are then sent for histological analysis to confirm cancer and identify the type of stomach cancer. For example, whether it's a gastric adenocarcinoma or a lymphoma or any other type. Then, imaging studies like CT scan or MRI are done to assess tumor size and potential spread. A PET scan is useful for identifying metastasis. An endoscopic ultrasound is used for staging by assessing the tumor's depth and the involvement of nearby lymph nodes. Blood tests, including complete blood count, are used to check for anemia. Tumor markers like carcinoembryonic antigen CEA and CA19-9 may also be elevated, but these are not specific to gastric cancer. Staging workup is done by laparoscopy, which is used in some cases to detect small metastases which are not visible on imaging. Staging is done using the TNM system. Treatment depends on the stage of the disease, overall health, and specific tumor characteristics. Now let's break it down. Treatment of early gastric cancer involves endoscopic resection. This is done for very early stage cancers which are confined to the mucosa, and techniques like endoscopic mucosal resection or endoscopic submucosal dissection can be curative. Surgery is also done and can either be subtotal or total gastrectomy, where a part or the entire stomach is removed with lymph node dissection and is standard for localized gastric cancers. Now coming to the treatment of locally advanced gastric cancer. This is often treated by neoadjuvant chemotherapy, which is pre-surgical chemotherapy and involves regimens like the FLOT regime and helps to shrink tumors and to improve surgical outcomes. Surgery involves gastrectomy with D2 lymphadenectomy, which is the removal of regional lymph nodes and is the preferred approach. Following this, adjuvant therapy is given, which is post-surgery chemotherapy and or radiation therapy, which may be recommended to reduce the risk of recurrence. Advanced or metastatic gastric cancer is treated with systemic chemotherapy. Combination regimens like FOLFOX or CAPOX are standard first-line treatments. Targeted therapy can also be used, often in HER2-positive tumors. Trastuzumab or Herceptin is combined with chemotherapy. VEGF inhibitors like ramucirumab or Cyramza may be used to block blood vessel growth in tumors. Checkpoint inhibitors like pembrolizumab or Keytruda can be used for PD-L1 positive tumors and nivolumab for certain advanced cases. In certain clinical trials, approaches combining immunotherapy with chemotherapy or other targeted agents to enhance outcomes are being tried. Palliative care is also important for symptom control and quality of life, including pain management and nutritional support. First is car-T-cell therapy. Now, this is a form of immunotherapy where a patient's T cells are engineered to attack cancer cells. Trials are exploring its potential in HER2-positive gastric cancer. Next are mRNA vaccines, which are inspired by COVID-19 vaccine technology. Now, these vaccines aim to stimulate the immune system to recognize and destroy the cancer cells. Another approach are bispecific antibodies. These antibodies can simultaneously target two different proteins on cancer cells to improve the precision of treatment. Next are tumor microenvironment modulators. These are drugs which target the tumor's microenvironment to make it less hospitable for cancer cells, so thus it inhibits the cancer growth. And next is hyperthermic intraperitoneal chemotherapy or HIPEC. This is a heated chemotherapy treatment which is directly applied into the abdominal cavity during surgery for peritoneal metastasis. Now, after treatment, regular follow-up is crucial. This often involves surveillance endoscopy for early detection of recurrence, periodic scans to monitor for metastasis, and nutritional support to manage dietary changes after gastrectomy. Advancements in diagnostics and treatment have significantly improved the outcomes for gastric cancer patients, but early detection remains key. If you found this video helpful, don't forget to like, share, and subscribe for more medical updates. Thanks for watching and see you in the next video.